How long do the results of the facelift or neck lift last? Will you need another facelift in your lifetime? In this video, you're gonna find out. My name is Dr. Alexey Markelov. I'm a double board certified plastic surgeon. So let's talk about facelift and neck lift procedure. This is a relatively common procedure performed in our practice. And the question I get all the time is how long my results will last? And the answer is it all depends. Well, it depends on your skin structure, it depends on your elasticity of your tissues. On average, the results of the facelift, you should see the difference for at least 10 to 15 years. Does it mean that in 10 years everything is gonna sag and you're gonna look back to where you started? The answer is no. You actually always look a little bit better than your peers. You're always a little bit ahead. You kind of turn the clock backwards by performing face or neck lift procedure. The results on average, as I said, can last for about 10 years. However, it can be affected by multiple different factors. For example, your skin elasticity, stretchability of your deeper tissues. In my practice, I like to perform deep plain face and neck lift. So instead of suspending just the skin, we actually rely on the deeper tissues under the skin called superficial muscular aponeurotic system, or connective tissue layer that extends, starts on the neck as a platysma muscle, the most superficial muscle, and then extends into the face as a SMAS, that connective tissue layer. So we work under that layer, dissecting the planes under that layer, and we suspend in that layer, and the skin just passively follows. This allows us to achieve better looking, more natural looking, and long lasting results. Will you need another facelift in your lifetime? Well, it all depends on how long you live and if you still care when you're much older. But it's not uncommon for people live longer and they're healthier, and it's not uncommon for us to see patients who get another facelift or even the third facelift in their lifetime. You just always want to stay kind of ahead of your peers. If you start seeing some jowls, then you're losing the definition of your neck and you want to address the mid portion and lower portion of your face. Face and neck lift procedure can be a great option for you. Should you get a facelift and wait for things to get saggy and worse before you proceed with the facelift? Well, the answer is usually patients that come for our initial consultation, they start with something they kind of ease into. They start initially with minimal invasive treatment options, laser, radiofrequency, sometimes injectables. And when those don't cut it anymore, you're looking for more drastic results with a little bit more downtime, then a face and neck lift procedure can be a next step up. Should you wait to get the face and neck lift? The answer is you don't have to. If you look at your face and certain things bother you a lot, such as loss of the definition of your jaw, or the jowls, deepening of your nasolabial folds, loss of the cheek volume, kind of everything feels that it's drooping, then the face and neck lift procedure can be a great option. There's no fixed age or time frame when you should get it done. If it bothers you enough, come see a surgeon for consultation and discuss all the pros and cons of doing revisional facelift. Or when you go back after that first procedure, usually a little bit harder, but still can be safely done. And again, doing the facelift early in your lifetime does not preclude you from getting face and neck lift procedure later down the line when you're much older. Is there anything you can do to improve the longevity of your result? Well, I think frequently it doesn't depend so much on the person itself. However, I've noticed over and over that if someone is a smoker or starts smoking after the procedure, the results don't last as long. Simple as that, and I discussed that with some of my patients. You lose that skin elasticity quicker. There's also a significant genetic component, kind of your body composition component, so you cannot change that. However, staying overall healthy, maintaining your weight can also improve the longevity of results. Certain supplements, collagen supplements, red light therapy, frequent exercises can probably good for your overall health and can potentially prolong the result of your procedure. However, again, the evidence is very limited and very weak. Staying within your healthy weight helps a lot because we see a lot of patients with what's called now Ozempic face, or people who lost significant amount of weight with diet and exercise, with the medications after weight loss surgery such as gastric bypass. And yes, the skin tends to lose volume. The skin was stretched out with all that extra volume of the face, and when you lose that volume of the face, things kind of start hanging and go down. You lose that definition, and your face looks a little bit longer. That's why we frequently combine our face and neck lift procedure with the fat transfers, where we try to revolumize the face and add volume where it needs to be. Ideal youthful face usually looks like an inverted triangle. So fuller cheeks, narrow chin. When we age, with the gravity, with the time, events in your life, face assumes a triangle shape. So you lose the volume in your cheeks and your jawline starts getting a little bit wider from all that extra fullness and volume in the lower portion of the face and with the jowls. I hope you find this video helpful. Click the like button and subscribe below. Thank you.